you everybody for joining, and a big thanks to our partner, the Elsevier Foundation. My name is Andrew Spiegel, and I am the board chair of the World Patients Alliance. And we're really pleased today to bring you this webinar, which will include the live screening of the Doctor Safety Flipbook. With this program, you can learn about the importance of patient safety and how stories can teach us to stay healthy and to stay strong. Next slide. Next slide. So for those that require a different language than English, all of our webinars are cast with multi-language broadcasts. So you look at the chat, you will see a link to Wordly. You select your language. After clicking on the link, you enter your name and you click attend. It's that easy. Then you'll be able to click on unmute and listen in the language that you selected. So go to the chat and click on the Wordly link if you'd like to listen in your own language. Let's go to the next slide. So just a very brief introduction to who we are because we're running a bit behind. We are the largest umbrella nonprofit organization working across all diseases. Next slide. We are made up essentially of patient organization members as well as other stakeholders in the industry. And currently we have 671 member organizations from 135 countries. And you can see at the bottom the geographic distribution with 162 members in Europe, 151 in the Americas, 211 in Africa, 131 in Asia, and 16 in Australia. Next slide. So this is not the first patient safety book for children. There's 5 patient safety books that have been developed by the World Patients Alliance in collaboration with Elsevier Foundation. They're available in English and Portuguese. There's 3 doctor safety flip books that are audio created by the South African Cystic Fibrosis Association. Translations have been done in different languages, are currently done in Hindi, Indonesian, Arabic, Afrikaans, and Greek. You can see some graphics here from what these books look like. Go to the next slide, please. And with that, I want to turn things over to our moderator for the day, Rita Viljon. I'm sure I messed that up, even though I tried. Rita, you are the patient empowerment and advocacy lead for the Cystic Fibrosis Association in South Africa. You're a seasoned life coach dedicated to transforming both individual lives and organizational approaches to patient care with an innovation and caring perspective. She champions new ways of thinking about patient safety, ensuring every voice is heard and empowered. Rita's mission remains clear, which is to inspire a culture of safety, empathy, and empowerment for all. So Rita, I turn it over to you. Thank you.
Thank you, Andrew, and thank you very much for having me tonight. So I think we all are waiting with full of anticipation of what does our agenda look like. So we'll hand over just now to find out a little bit more about the dream and how did the Safety Patient League come to life. We will then check in with SACFA again to find out how did SACFA get involved in this important project. A little bit later on, you will see where the Flipbooks is going to be shown. We have a lot of people on the call today that we can't wait to introduce. We've got a full lineup. So let's jump into it immediately. And with that, I want to introduce the father and the mother of patient safety, according to me. And it's my honor to introduce Lays and Thiago. Lays is in the Netherlands. Thiago is in, and they just went, Brazil, right? Brazil, okay. They are incredibly clever people. So here we go. Lays, she has an MBA in healthcare and innovation, quality, patient safety, and innovation manager and member of Clinical Best Practice Council at the Elsevier Scientific Council. She's emerging disease task force member. Equity and Diversity Team member, Brazilian Society for Quality Improvement and Patient Safety. She's an honorary member of the Patient Safety Foundation in Chile and an associate member of the International Association of Innovation Professionals. But for me, Lays is the beautiful, energetic spark that fills a room. Tiago, he is a pediatrician. He's a specialist in quality care and patient safety. He has a master's degree in pediatrics. He works at the Hospital Clinics do Porto Alegre in pediatrics and in the quality program works at Hospital Moinhos de Vento as a medical consultant for projects in social responsibility, head of the pediatrics working group of the Brazilian Patient Safety Society. I met Tiago on a video that Lays showed me, and I saw a singing, poetic, fantastic, inspiring, and passionate doctor for patient safety. To you guys, here we go.
Thank you so much, Rita, for the great introduction. You made us both smile. We're here, greeting at the screen. Thank you so much. I would like to share with everyone the reason why we all got engaged into this. I think you were very kind, Rita, to say we're the mother and the father, but I think this is a very large family with Doctor Safety that we have. And it's my pleasure to represent a bit of this family here. We have a great group of people that supported this project. That includes you. And I'm just very excited to share the reason behind it. And if you can go to the next slide, please. I can share with you a bit more about our Doctor Safety book series. This is a series, as Andrew mentioned at the beginning, that is focused on patient safety. And if you can move to the next slide, please. I'm going to ask you all now to take a moment, to take a couple of seconds and think about the first time you came in contact with patient safety or with patient advocacy. I think some of you will have to go back many years. Some of you will go back less years. But for the majority of the people, when we talk about this doesn't necessarily bring good memories. Many people got engaged into patient safety or patient advocacy because of an event that happened to themselves, an event that happened to their family members, or maybe you're a doctor and you got engaged, something happened to a very close patient of yours. Usually this is a moment that it can be for many people a traumatic moment. So together with a brilliant group of people, we started thinking, what if we could change the way that people first came in contact with patient safety? And if you can move to the next slide. What if we could turn patient safety into a habit, not only for us, but for the future generations? Something as usual as brushing your teeth in the morning or brushing your teeth after your meal. And if you can move to the next slide, you will see that we actually have one more. You will see that we have examples in our society of work that is done with children that really supports the future generations. The lessons that we learn in school can really lay the habits of a lifetime. If you can move to the next slide, I'll share with you 3 examples. The first one is with the recycling movement. The second one is nutrition programs. And the third one, financial education. We have literature published on that, how teaching them young, really starting from the start, teaching from the start can really support laying the habits of a lifetime. Now, to share a bit about the pediatrics perspective of all this, I would like to invite my good friend and lead pediatrician, Dr. Tiago Dalcin, to share his perspective on why is this so important? Why is it important to talk about patient safety for children and to children?
So thank you, Lais. Thank you, Rita, for your warm introduction, and it's such an honor to be here with you, talking about a project that it's a gift for me to make to be part of this great team that we call Safety League. So basically, when you talk about pediatrician and safety, it's so important that we can build a safety culture in the whole society. The word safety in pediatrics usually is related to prevention of accidents, like, for example, car accident or domestic accidents. But we are talking here about a different perspective of safety. When children get involved in healthcare, they are more vulnerable. So basically, we have to understand that they can have more damage that are related with the healthcare itself. So we try to prevent this damage that healthcare can make in these children by building a different culture. And one of the key aspects when we are talking about building a different culture is to involve the kids and their family in this care. So it's very strategic to start this as soon as possible from the very beginning. So basically, it can change the whole game and the whole perspective. And luckily, in the future, we believe with this kind of projects, we can make much more natural, as Lais was saying, that we wash our hands like we are brushing our teeth. So we truly believe that this project can make a big change and a real change in the future of the next generation and this generation by involving the kids in this process and their families.
Thank you so much, Thiago. Hadis, if you can move to the next slides, I will now share with you the core objective that we have with this. So our core objective, and you can click through the animation, Hadis, is really to empower the community to act for safer care through the education of children by developing a children's book series that supports education about patient safety. In other words, it's teaching the children the fundamentals about patient safety so we can all be safer as a community. And to do that, we have stories that embrace representation from all over the world. In the next slide, you will see some of the characters that we have in our stories, from Lucas, a little boy from Latin America, to the twins that we have and the friends that we have from the Middle East, the twins that we have from Asia. So we try to be as representative as we could. And you will see during the books, through the illustrations, the habits that are portrayed, that really we were trying to make an effort in which children would feel represented, and at the same time, they would also learn about different cultures. And on the next slide, you will get to know our superhero, Dr. Safety. Dr. Safety is our superhero, and her superpower is sharing knowledge. She shares knowledge with children about patient safety. Hadis, if you can move to the next slide, people can see Dr. Safety in all her glory. There she is. So how do the stories work? All the books, they have the same story arc, which is, on the next slide, you can see that. We start with a normal day. A child is facing a normal day. And then they will go through some challenges and temptations. During those challenges and temptations, such as not washing their hands on that day, they meet Dr. Safety, the mentor. Dr. Safety then teaches them and really drives a transformation through knowledge. And after that transformation, the child will then engage into safer behavior and become a member of the Safety League. sharing that new information with others. On the next slide, you can see the 5 books that we have about hand washing, about medication safety, antibiotics, when to see a doctor and how to talk to a doctor, and about injection safety as well. Now, on the next slide, you will see the family that I spoke about earlier today, which is formally called the editorial board. Here we have, I couldn't be more honored, and I really feel a lot of gratitude with this new formed family that we have. Helen Haskell, Hussein Jaffrey, Regina Canoga, Cristiane Tavares, Thiago Dalcin, that's me, and our illustrator who brought all this into life, Pedro de Luna. And the 3 other people from this family are the 3 members of the Elsevier Foundation that are on the next slide. Ilan, Domisiana, and Maha, they really supported us since the start, and I couldn't be more grateful for making this a possibility. Now, on the next slide is where I'm going to ask everyone, please take your phones and take a photo of this QR code. We're also going to post that on the chat. There are 3 different addresses here. There are 2 QR codes where you can download the books so you can read them yourselves. And there's also an Instagram of Doctor Safety Books. And I invite you all to share messages there, to post pictures, to tag us, because we are really excited to share that messaging with everyone. And as we're doing that, we have a surprise for everyone. Dr. Thiago actually is a singer and an artist, and he created a song for Doctor Safety. And I would like him to share that song with you as we are all scanning and downloading our books. I see there are some questions about languages. So the languages that we have currently available are English and Portuguese, and very soon we will have Hindi uploaded, we'll have Spanish uploaded, we'll have Greek uploaded, we will have Arabic uploaded, and many more to come. Now, also a request, bit off script. If you speak any language that is not in the website and you feel like volunteering, please reach out to us and help us translating this book into more languages so we can reach more children. With that, I'll let Thiago sing to us. Thank you.
You can help yourself. You can help your loved ones. Let's talk about your safety now. It can be fun. You can teach a friend. You can teach everyone. Welcome to the Safety League. Have a good one. Dr. Safety welcomes you to the Safety League today. Dr. Safety welcomes you to the Safety League. Stay safe.
So much, Thiago. That was great.
Thank you.
Now hand back to Rita. Rita, kick it off.
Thank you, thank you, thank you. So I was sitting at the World Patient Alliance conference in Cape Town. I heard about the safety books. I was shocked to see how many incidents we have worldwide that's costing lives. And I came back and I asked myself, is there something I can do? And I realized that this is so often we feel there's these big problems out there and there's nothing we can do. And this is kind of also one of those challenges that I want to give out tonight, to say, sometimes you must just be brave enough to say, let me try. And this is what happened with SACFA. Lay said that she would love to see translations of books. And then I said, but hang on, what would happen if we maybe add voices to the books? And I ran up to her after her piece of the conference, and I said to her, "Would you allow me to try to just put a voice to Dr. Safety Books?" And she took a chance. Tata ma chance, tata ma millions. And and that is the beauty of volunteering. And this is also one of those invites that I would like to hand to everybody tonight here, is to say sometimes you must just reach out and say, let's see if I can do this. And with no further ado, I was introduced to Kevin Abbott. It was very odd to speak to somebody with this perfect velvet voice over the telephone. And unfortunately, I can't be here tonight. He's got a function that he has to host, but he sent us a little video. Please, Harris, would you um, play Kevin's video for us?
Good morning, good afternoon, and good evening to everyone joining us from around the world. My name's Kevin Abbott, and I had the pleasure of being both the narrator and the producer of the Doctor Safety audiobooks. Firstly, thank you, reader, and all of the role players who were responsible not only for these books, but also for the ongoing message and mission that is being broadcast out into the world. Our children are our most treasured and valuable resource, and it is quite something to realize just how much of an impact a simple gift of education can make to a child and to their health. This is one of the reasons why, when Rita first approached me about these books, the idea of crafting and creating an audiobook and narrative accompaniment to them was very exciting. I was privileged enough to be introduced to Rita through my very dear friend Kerry, whose daughter Kayla has cystic fibrosis. Health and hygiene has always been a critical part of their experience, and they've shown me just how hard parents of children going through health difficulties have had to push through and just keep going, because stopping really isn't an option for them. The audiobook was one way in which I felt that I could give back to the community and give beyond just my local field of influence. And when I brought it to the attention of Tara McPherson and David Wilkie, the other two voice artists on the project, they were only too keen to donate both their time and their studio time. And I think that they did an outstanding job. On top of that, my dear friend Michael Wilson Trollope, one of the most talented musicians and music producers of his generation, who records a majority of the soundscapes that you will hear on CakeNet shows here locally, as well as TV series, he agreed to create a royalty-free soundtrack to use in the audiobooks, with all permissions granted and fees waived. And he was brilliant in keeping it simple, but international and effective. From our side as a production team, it has been such an immense privilege to be involved in this project, and we can only wish that it goes beyond all of your wildest expectations. And hopefully one day we will be able to look back and see just how much of an international impact it has had on the health of children around the globe and the generations that follow them. Rita, again, thank you for being bold and for asking. And to the rest of the team globally, thank you for all that you do. You are heroes, and you are acknowledged.
Thank you so much. Kevin, without you, your vision, your dream, your hard work, this would not have been possible. So thank you to all the voiceover artists and to our musician. And with that, we are so honored to say tonight, Hussein, World Patient Alliance, Elsevier, here is your Flipbooks. We managed to do this. Harris, will you just start that jingle so that everybody can hear what the books sound like when they start, please?
Yes, thank you, Rida. Thank you very much. We are so grateful.
Okay, I don't think the jingle is working. We'll look at it in a couple of minutes' time. But Lace, Tiago, I've got a further big surprise, and that is that we managed to also translate it in Afrikaans. So it's with a great excitement that we can say at least 3 of the books have been translated into Afrikaans. And this is our small participation in this immense project with so much value. And may this really bring back fruitful and beautiful things and just grow your vision and just grow all your hard work. So, yes, here we go. We've got the Afrikaans. So, en dit was 'n verskriklike groot voorreg vir ons om saam te werk en regtig planne te maak om hierdie produk van hoogstaande gehalte vir die World Patient Alliance te kon oorgee. So baie dankie vir almal wat my gehelp het in hierdie projek en nog steeds bydra. Ons het 'n groot waardering. So I hope this brings you a lot of joy and a lot of fruit and a lot of movement, you too. With no further ado, I am going to introduce the chairperson of the South African Cystic Fibrosis Association. Her name is Kimberly Kaiser. Kimberly is our chairperson. She lives with CF herself. She's deeply committed to the community, driven by her own experience as a past beneficiary of SACFA's support. Her leadership focuses on fostering a healthy, supported, and unified CF community, fueled by a desire to just give back to us. So, Kimberly, thank you so much for everything you do for us in South Africa as well. And I'm handing over to you.
I think the thank you should be to you, Rita. You took up this challenge and just ran with it, and it has turned out beautifully. Thank you so much for organizing this. And thank you to the whole team. I think this is an opportunity that SACFA can give back to a global community and do our part as well to help every child. I'd like to welcome everyone to get their popcorn, and we will be starting the Dr. Safety Flipbooks screening live. The first book is called I Don't Want to Wash My Hands. And while you're listening, I'd love to hear where you're from, if you can put it in the chat and let me know. I know there are quite a few people who have already commented across the globe. And I would love to hear anyone else as well. Thank you. Let's start book 1.
You're listening to I Won't Wash My Hands Today. This is Lucas. He just woke up after a great night of sleep. Good morning, Lucas. Lucas walks to the kitchen, where his mother is preparing breakfast. He is ready to eat when his mom reminds him.
Lucas, please wash your hands before eating.
Lucas is not happy about having to wash his hands. He doesn't understand why this is a rule in his house. And he decides,
I won't wash my hands today.
Lucas eats his breakfast and starts his day. He pets a dog. He goes to the bathroom. He plays soccer with his friends. And it is time to go home for lunch. After all the playing, Lucas is hungry. He sits down at the table to eat, and suddenly, Dr. Safety appears.
Lucas, stop right there.
Who are you?
I'm Dr. Safety, and I was sent here to help you be safe. There are bad germs that are waiting for a chance to get into your body.
But I can't see anything. Where? Where are the germs?
Oh yes, I forgot. You can't see the germs. Let me get my super powerful special magnifying lens to show you the germs.
Lucas looked through the magnifying lens at his hand and sees all kinds of germs on his skin.
Oh no! How did they get here?
Germs live everywhere, Lucas, and they climb on our hands during the day.
Oh no! Then I can't play outside anymore.
No, Lucas. All you have to do is wash your hands with soap when you are done. Let me show you. Let's start by wetting our hands. Then put a little bit of soap on them. Scrub, scrub, scrub for 20 seconds. Sing with me. Happy hand scrubbing to me. Happy hand scrubbing to me. Happy hand scrubbing to me. And to Dr. Safety. Now we rinse off the soap and dry our hands on a clean towel. Or we can let the air dry them too. Just make sure you don't blow on them. Let's look at your hands now, Lucas.
Thank you, Dr. Safety. I didn't know washing hands was so important.
Yes, Lucas. Washing hands is very important and keeps you safe from germs. You're incredible. Here is a badge to celebrate. Welcome to the Safety League. Stay safe. And all of you listening can help others keep safe too by teaching them how to wash their hands.
That's right. You can help keep yourself and your loved ones healthy by washing your hands often, especially during these key times when you are likely to get and spread germs. Before and after eating. Before, during, and after preparing food. Before and after treating a cut or wound. After using the toilet. After blowing your nose, coughing, or sneezing. After touching an animal, animal feed, or animal waste. After touching garbage. And whenever your hands are dirty. Be like Lucas and teach someone how to wash their hands today. Let's do it. You've been listening to I Won't Wash My Hands Today by the Elsevier Foundation and the World Patients Alliance, with the voice talents of Kevin Abbott, Tara McPherson, and David Wilkie. And a big thank you to the South African Cystic Fibrosis Association for making it possible.
That was great, wasn't it? I just love it. Every time I listen to that, and believe me, I've listened to it multiple times, dozens of times, I always get that same feeling of happiness, and I can't just remove that smile from my face. Well, hand washing is so fundamental, and it's something that all children should know and learn how to do by heart, right? So I hope that you can share that book, you can share that message with all the children around you so they can enjoy that. Now, on the next book, what we will see is a story of two girls that engage into not so safe behavior. And I think we've all faced that before, right? You get hurt, you don't want to be told off. Well, actually, that's the should I take this medicine? Sorry, let me change my script. So two boys this time. This is a story about two boys, and they also engage into unsafe behavior. And I think, many adults also engage in that same unsafe behavior, which is sometimes you have a friend or someone you know, a neighbor that is not feeling too well, and you offer the medication that you took a couple of days before because you felt better. Well, It's time to teach the children that this is not safe at all. And there is more to medication safety than they expected. So with that, let's kick off Should I Take This Medicine? With Dr. Safety.
You're listening to Should I Take This Medicine? It was a spring day, and the park was full of children playing after school. Ali and Ahmed were having fun on the swing. Suddenly, Ali's laughter stopped, and he groaned.
Ah, oh no, Ahmed, my stomach feels funny.
Ahmed immediately ran home to look for something to help his friend. In his mother's medicine cabinet, he found some medicine that his mother had once given him and ran back to Ali in the park.
Ali, take this medicine. It made me feel better once. It should help you too.
At that moment, they were startled by a sudden flash of green light.
Hold on, Ali. Don't take that medicine.
Who are you?
I'm Dr. Safety, and I'm here to help you. Just because Ahmed got better with this medicine doesn't mean you will. Stomach aches can happen for different reasons. That is why you should ask an adult you trust or a doctor to help you. They can give you the right medicine and tell you how much to take.
Can't I just take the same medicine as my friend did?
Good question. Just as we are all different, our bodies can react differently to medicines too. Some people, for example, are allergic to some medicines. This means their bodies don't react well with these medicines. And there are different doses of medicine for different people.
How do I know when to take medicine?
Let's take a look at examples together. When the doctor says medicine twice a day, it means you should take it about 12 hours apart. Next, when the doctor says medicine 3 times a day, it means you should take it about 8 hours apart. Also, medicine, like food, can go bad after a while, so always check the expiration date. If the date is older than today, you shouldn't take it.
At that moment, Ahmed realized with embarrassment that the medicine he had given to Ali had expired. Dr. Safety continued.
We shouldn't share medicine, and children shouldn't take medicine on their own. That's why medicines should be kept in safe places at home.
Ali, a little scared, asked,
But what should I do? My stomach still hurts.
Ahmed promptly said,
I can see my mother is coming back from work now, Dr. Safety. I'm going with Ali to ask her for help.
Ahmed said,
Thanks, Dr. Safety. I'll give this old medicine to my mom to throw away. And from now on, I promise to offer only water.
Wait, there's one more thing.
Both boys were suddenly surrounded by a soft green glow. When they looked down, they were wearing shiny gold badges with a green emerald, just like the emerald Dr. Safety was wearing.
You two are now champions of medication safety. Take these safe medication badges and teach others about medication safety. Stay safe.
With the help of Ahmed's mother, Ali got the medicine he needed to get well. Be a safety champion like Ali and Ahmed. Always check the expiration date of your medicines. Take your medicines as prescribed by a doctor and ask an adult for help when taking any medicine. Let's do it! You've been listening to Should I Take This Medicine? By the Elsevier Foundation and the World Patients Alliance. With the voice talents of Kevin Abbott, Tara McPherson, and David Wilkie. And a big thank you to the South African Cystic Fibrosis Association for making it possible.
So excited to see Ali and Ahmed to having this kind of learning and a new, very important knowledge about medication safety. And the next book, we have two twin sisters that don't want to see a doctor. That's quite common because some children they get sick and they're afraid because they don't know, or sometimes they got an injection or was painful and they want to hide to the adults that they're feeling sick. And that's important to realize that the sooner the better they talk to an adult. And let's see what Dr. Safety can teach to Lee and we.
You're listening to I Don't Want to See a Doctor. Lee and Wei are twins and live with their grandmother. One sunny afternoon, on the way back from school, Lee is very quiet. Wei finds it odd.
Lee, you are very quiet. Are you okay? I don't know. I fell at school 2 days ago and hurt my leg. I've been hiding it from Grandma as I think she will be upset with me.
Lee shows her sister her injury, a nasty red scratch. Determined to help her sister, Wei tells their grandmother what happened to Lee. Grandma looks at Lee's leg.
Don't be afraid, my sweet Lee. I will clean the wound on your leg with soap and clean water. Oh no! Is this going to hurt? Don't worry. It will hurt just a little, but I'll do it very gently.
Grandmother then says it would be best to take Lee to the doctor's clinic, as doctors understand wounds better. Lee runs to her bedroom and locks herself in.
I don't want to see a doctor!
Suddenly, Lee sees a flash of green light, and someone with a big smile appears in front of her. It is Dr. Safety.
I'm Dr. Safety, and I'm here to help you with your health. Lee, besides the pain from the scratch, are you feeling anything else? Dr. Safety? I don't know how to say what I feel. We need to listen to what the body wants to tell us. Close your eyes and think about each part of your body. Do you feel warm? Do you feel tired? Does anything hurt besides your leg? You should tell the doctor how you feel. Don't be afraid. Doctors are there to help you get well and feel better.
With the courage she has gotten from Dr. Safety, Lee leaves her room, holds her grandmother's hand, and together they go to the doctor's office. Lee remembers Dr. Safety's words and explains to the doctor.
I feel really hot and sweaty, and my body feels achy and tired, like I just finished playing catch for hours. And my leg hurts.
Thank you for describing it so well. It sounds as though you might have a fever. A fever means that your body gets warm all over in response to an infection. Let's check your temperature with this thermometer.
The doctor explains to Lee and her grandmother that Lee has a mild fever and that the wound has signs of infection.
What is an infection?
Imagine your body is like a castle,
says the doctor.
The skin is like a wall that keeps out germs. When you have a scratch, you have special white cells that rush, like soldiers, to overcome the enemy. But if the scratch is very deep or the germs are very strong, sometimes the white cells need help. If too many germs get into your scratch, it can get swollen and you may even feel bad all over. That is called an infection. That's why it's important to clean wounds as soon as possible and listen to what your body is telling us, so we can keep our castle strong and healthy.
The doctor gets a special liquid called an antiseptic to clean the wound.
Will it hurt?
Don't worry, I'll be very gentle.
He waits for the antiseptic to dry, then places a bright plaster on Lee's leg. He gives them medicine to fight the infection.
Lee, it is very important to keep your wound clean and dry and to take the medicine just like I told you. Take the pills until they are all finished to be sure we have killed all the germs. If your fever goes up or if you don't feel better soon, please come see me again.
Lee and her grandmother waved goodbye to the doctor. At home, Wei is waiting for Lee. They hug and sit down to play with their castle.
Was it scary? No, it was really cool. From now on, I will always tell an adult when I get hurt or when I feel sick. Thank you for telling Grandma for me.
Suddenly, a flash of green light comes from the castle. Lee looks inside and finds a little note from Dr. Safety.
Dear Lee and Wei, you did an excellent job. These shiny badges are for you. You are now champions of safety. Now go on and teach others about understanding their health. Stay safe.
Be a safety champion like Lee and Wei. Listen to your body and talk to an adult when you get hurt or feel sick. Let's do it. You've been listening to I Don't Want to See a Doctor by the Elsevier Foundation and the World Patients Alliance, with the voice talents of Kevin Abbott, Tara McPherson, and David Wilkie. And a big thank you to the South African Cystic Fibrosis Association for making it possible.
Hi, thank you so much. I really love them. As Les said, every time I watch these, I really enjoy them. I feel like a kid myself. So we at World Patient Alliance are so pleased to launch this great initiative, which is a great significant milestone in our mission to improve health literacy, especially among younger generation. And by introducing essential patient safety concepts in child-friendly format, we aim to foster a culture of safe care for the future. So we encourage parents, educators, and healthcare professionals to explore these resources and join us in promoting a safer, healthier future for all. We are literally receiving so many requests for these books to be translated into many different languages in the world, especially when this year's theme of the World Patient Safety Day by the World Health Organization is around newborn and pediatric care. So if you think you can also get these translation done into your native or your national languages, please do contact us. It's a very simple procedure and we let you know. I think as many as languages available with us, I think that the message will go out to more and more people all over the world. And then it's been a great honor for me to be on a personal level to be part of this great project as well as part of this dedicated team. And taking this opportunity, I would like to thank the editorial board led by Liz, who has made this possible. This team has really worked over more than a year to develop these books. So a big thanks to the editorial board. We are also extremely grateful to Rida, Kim, and South African Cystic Fibrosis Association, as well as the Hey Abbott Studios for giving voice and developing the Doctor Safety Flipbooks. Don't this sound wonderful? I think they are wonderful. They've certainly given life to Doctor Safety books. And last but not least, I would like to thank all the speakers of the webinar today. And thank you all for attending this webinar. And my message again, please let us know if you can help us in translating these books in different languages of the world. So we look forward to hearing from you. Thank you, everybody, for joining the webinar.
Thank you. Stay safe.
Thank you.
Thanks, everybody.
Thank you. Bye.